Well, good morning. It's truly an honor to be here in front of you today to talk about chemical exposures during firefighting. So this is a chimney sweep from the 1700s. And there are really two things that I want you to take away from chimney sweeps. And that is they tended to be young men or even boys in some cases. They were of small stature, so they were able to climb up and down these chimneys. They often wore loose clothing. And more importantly for today's discussion is they have the distinction of being associated with the first case of occupational cancer, where these young men were developing scrotal cancer. The median age of diagnosis was 38 years, but children as young as 8 years old develop scrotal cancer. And researchers believe that the primary cause of their scrotal cancer was their soot exposure, and specifically the PAHs that were in the soot. So fast forward to today and the US firefighter. Now, I sincerely hope that the culture in the fire service is changing, that having a soot-covered body, soot-covered face is no longer a badge of courage. But as you know, that this was relatively common in the fire service. And we've heard today that firefighters have a number of cancers that appear to be elevated. We've already heard this is a lot of review about those cancers. But firefighters are, of course, exposed to hundreds, if not thousands, of different chemicals, including soot and specifically PAHs. So the way that exposure scientists like to look at your exposures is what we call an exposure pathway. And so this is sort of a comprehensive view of how someone can be exposed. And so it considers the source, so where the chemicals come from, where they originate, how they are emitted into the air. If they are present in the air, can they settle on surfaces? Do those surfaces include your protective clothing? Can they penetrate or permeate your protective clothing? Contact the skin? Can they transfer from the clothing to your skin? If they get on your skin, are they absorbed? Do you potentially ingest them when you're eating if they're on your hands? So as you can imagine, this is a rather complex process, especially when we look at firefighters. So if we start out with the source, if you were to ask just somebody in the general public, they would say that firefighters respond to house fires. That's your source of exposure. And of course, that is one source of your exposure. But there are multiple different types of fires. So you can have dumpster fires, you can have vegetation fires or wildfires. You might respond to an industrial fire, sort of, one of these big fires, chemical plants. Car fires, are you near an interstate? If your department's near an interstate, that can be a major source of your exposures. Training fires, if you're an instructor, training fires may constitute the majority of your exposure to combustion byproducts. And so we've heard some of these chemical classes today. You've heard about PAHs, you've heard a little bit about VOCs. And what I want you to know is that whenever you burn anything, any organic material, even a campfire, you're going to produce some of these compounds. So you're going to produce PAHs, VOCs, aldehydes, even acid gases. But as we heard from Steve Kerber, our structures today they're filled with synthetic materials. So now that we have all these synthetic materials inside the structures, you have other combustion products that you have to be concerned about. So for example, phthalates, which is a type of plasticizer. Polybrominated diphenyl ethers, or PBDEs, which are a class of flame retardants that's largely been phased out because of some of the toxicity concerns. But guess what? It's still in our structures. They'll still be in our structures for decades to come. I imagine many of the seats that you're sitting on right now have PBDEs in them. Okay? Dioxins and furans. Dioxins and furans are considered some of the most potently toxic chemicals that can be produced. And if you burn plastics and foams and things like that, you're likely to produce dioxins. Organophosphate flame retardants, which have largely replaced the PBDEs. You may have heard of organophosphates because they're a class of pesticides. And then what most of your trucks and apparatus run on is diesel. And diesel exhaust is also a concern from a health point of view. And you can see in the right column here, we have potential health effects. And these chemicals can produce numerous types of health effects. But as you can see with the bold, that many of them are carcinogenic. So we have an idea of what the source is, the combustion byproducts. And naturally, those are released into the air. And there have been a number of studies that have looked at the concentrations of some of these compounds in the air. So if just thinking about a structure fire, there have been measurements that have looked at these concentrations inside the structure during a fire. Now, I understand firefighters are wearing SCBA for the most part during the attack of the fire. But the concentrations are enormous. And so a good example of this is benzene. Benzene is a known human carcinogen. We and others have measured benzene concentrations in excess of 40 parts per million. To put this into perspective, the NIOSH short-term exposure limit for benzene is 1 part per million. That's what you're allowed to be exposed to for a short period of time, 15 minutes or less. So this is 40 times the levels that are allowed. And then we know that there's a lot of smoke, there's a lot of particulate being produced, very small particles that can deposit basically anywhere inside the structure. How about during overhaul? Now the concentrations will certainly diminish over time during overhaul. But we and others have measured concentrations above exposure limits for compounds like PAHs and benzene during overhaul. And really, a lot of this depends on the amount of ventilation and if there's any materials that are still smoldering. What about outside the structure? Well, we've looked at some of the fireground concentrations, so to particulate and VOCs, those can be well above background concentrations. But this also depends on atmospheric conditions. Do you see a lot of ground level smoke, for example? The wind direction, are you upwind or are you downwind? And then one thing that I really want to draw your attention to is that if firefighters are doing outside ventilation very close to the structure, opening up windows, opening up the roof, we've done measurements where we've found IDLH levels of hydrogen cyanide during outside ventilation. And IDLH is the immediately dangerous to life and health level. These are acutely toxic levels of hydrogen cyanide. And then I've got two questions here. What about job assignment? How does that affect your exposures? What about tactic? What if you do transitional attack? How does that change your exposures? And these are questions that we're actively trying to address right now with our partnership with the Illinois Fire Service Institute. So obviously, if you have airborne contaminants, there's a potential to inhale them. And it really comes down to, for firefighters anyway, the use of SCBA. And I say, it's really important to wear SCBA in the hot zone in quotation marks, because it's important to look at it as a hazard classification. So, it's not just inside the structure, but also around the structure that we need to be concerned about. Position of command, obviously important, upwind or downwind. And the first bullet point here is that it's important to know that the inhalation route is the most important route. This is the most direct way that these chemicals can enter your body, aside from injecting them. Hopefully nobody's doing that. So it's absolutely critical that we're protecting our airways. The combustion particles are also extremely small particles. They're less than 10 microns. These are considered respirable particles. They're able to penetrate deeply into the lungs. And this is important because particles that can deposit deeply into the lower respiratory system, they can cause inflammation, clearance mechanisms are less effective, and any chemicals on those particles can be absorbed rapidly into the bloodstream. Okay, so you have these chemicals in the air. And as we know, those can then deposit onto surfaces, including the surfaces of your protective clothing. And so a number of studies have looked at the contamination on protective clothing, and compounds like PAHs, phthalates, flame retardants, metals, those have all been measured on turnout gear. And I have a question here. How effective is laundering? This is an active area of research. We'll hear later from Jeff Stahl about some of the work looking at how clean is clean. We looked at hoods, Nomex hoods, and this is a picture of a hood that had been worn for 4 structure fires and laundered after every fire, and a hood that had not been laundered at all. And what we found is that even though that laundered hood, obviously it looks cleaner, we found residual contamination of certain types of flame retardants in that hood. So this is an important question to answer. Just because we're finding these residual contaminants, doesn't necessarily mean it is a health concern, but it's certainly concerning, and it requires more research. With the study that we had with the Illinois Fire Service Institute, where we had firefighters attack residential fires in a training facility, we looked at the pH contamination on the turnout jackets. And as expected, we saw that with successive fires, there was more contamination on the turnout clothing. But we also looked at the job assignment. And firefighters who did interior attack and search had much higher contamination levels of PAHs on their turnout gear than firefighters who did overhaul. And then that was followed by exterior operations, the command and pump operator. And in fact, for those positions, they were near detection limits. Now, if your gear becomes contaminated, there's also the potential for off-gassing. And one thing that we did that was unique for this study is that we took 6 sets of gear and we put them in an enclosure that was representative in volume to the apparatus cab. And so the idea is these are the concentrations that firefighters could be exposed to during the ride back to the station. And what we found is that a variety of VOCs certainly did increase right after firefighting, just from the off-gassing. The other thing we found is within about 30 minutes, a lot of those VOCs returned to near background levels. And this was regardless of whether gross on-scene decon was done or not. And so this tells us that a lot of these VOCs will just evaporate naturally over time. And this is to be expected as well because VOCs are volatile. They're extremely volatile. That's why they're called volatile organic compounds. However, we might expect something different with semi-volatile compounds. And so that's another area of research that's being undertaken right now. Okay, so if the contaminants deposit on the gear, they may also permeate or penetrate the turnout gear and get on the skin, or they could be transferred to the skin. And so this is also something we looked at in the Illinois study. And so what we found is that, and we primarily looked at PAHs on the hands and the neck, and we found that the hands were more contaminated overall than the neck. And this is sort of different than what we found with some of our earlier studies. But what we had firefighters do in this study is what they would normally do. So firefighters who were doing attack and search were crawling on their hands and knees. They were using water. So a lot of this contamination may be simply because we were looking at realistic fire scenarios. Now, just because we saw more contamination on the hands than the neck doesn't mean that the necks weren't being exposed. And in fact, if you look at the more exposed firefighters, we found levels of PAHs on their neck on par with what we found on the hands. And so what gets onto the skin is important because we know that for PAHs, for example, that those can be absorbed through the skin. We know that if you apply coal tar to skin, about 20 to 56% of the PAHs will be absorbed within about 6 hours. We know that VOCs, which will exist primarily in gas phase or vapor, can be absorbed directly through the skin from air. We know that if you, in a study of monkeys, when they applied benzene to the skin of monkeys, that they were able to detect the benzene in the breath within about 30 minutes. which is about the same time where we see increased levels of benzene in breath. And there are a number of factors that can increase absorption of these compounds, like skin thickness, temperature, sweat, and humidity. And a good example of how skin thickness is important to absorption is looking at the hydrocortisone, the absorption of hydrocortisone by skin thickness. And so if you look at the jaw angle, which is an extension of your neck, it's about 93 times more absorptive than the plantar foot arch, which is some of the thicker parts of your skin. And we know from some studies that were done, like the FAST study that IAFF commissioned, that the neck will be exposed. And what about ingestion? Any firefighters here, do your hands look like this after a fire response? Are you doing a good job washing your hands before rehab, before eating? If not, there is this potential to also ingest a number of these chemicals. Some other important vehicles of exposure. Excuse my pun, but one vehicle of exposure is your vehicle. So a lot of these contaminants that are on your turnout gear may be able to transfer to your fire apparatus. You may be tracking those back to your fire station. We heard earlier about some of the work looking at the dust in fire stations and how fire stations appear to have higher levels of flame retardants than other occupational settings. What about your hood? What about your helmet? What about your liner of your helmet? What about your tools? What about the hose? All of these can be what we call fomites of chemical exposure. Basically, they carry the exposure and provide a way for you to contact those chemicals. The most important part of the exposure pathway, however, is what actually gets into your body. I could be standing on a pool of chemicals right now, but if it's not actually entering my body, it's not a hazard. So we actually want to look at the dose, what actually gets into your body. And so there have been numerous studies that have found, they've all consistently found, elevated levels of benzene and PAHs in the body of firefighters after firefighting. There's also been some studies that have looked at flame retardants in firefighters' blood and urine, and those appear to be higher than general population levels. And these figures here show some of the measurements we've done looking at benzene in breath. And what we found is that right after firefighting, there are elevated levels of benzene in your breath. And in this particular case, these firefighters were very well protected, wore SCBA the entire time. And so we think that much of the benzene is being absorbed through the skin. Some ongoing research that we've heard about already today, we are looking at flame retardants, what we would call farm to the table or farm to the fork, looking at what's actually in the furnishings, what gets into the air, what gets onto your turnout gear, and then what gets into your body. We're looking at training fires. I mentioned if you're an instructor, that this can constitute a major part of your overall exposure. We want to look at, and we are looking at, particle blocking hoods. Just how effective are those under realistic firefighting conditions? What happens when you repeatedly launder your turnout gear? If you're a progressive fire department, you may be laundering your gear after every fire response. So turnout gear that was once going through a couple launderings per year, maybe going through 10 launderings per year. How does that affect the protective properties of the turnout gear? We've heard a little bit about the IAFF N4's exposure tracking application. We'll hear more about it today. And one thing that we're doing is we're partnering with IAFF. We're working with the University of Arizona and Miami on the prospective cohort study to really try to evaluate this system and provide quantitative data to validate it. We have the cancer cohort study with University of Arizona and Miami that we're working on. We also, as you've heard, about the cancer registry that NIOSH would be leading if that gets support by Congress. And then NIOSH is involved in a wildland firefighter study that's a very comprehensive study looking at multiple different types of health effects as well as exposures. So those are a couple things that are happening now. I just want to acknowledge that this research, I'm sure you can imagine, you've heard a lot about this already today, this requires just an army of researchers. And what's really nice about the folks who are doing this research is that we all know each other. We all get along with each other. We're all sharing this information. In many cases, we're collaborating with each other. And so that makes the data go a lot further. And we can't do this work without the funding from FEMA, from the CDC Foundation, from National Toxicology Program, and others. So I feel like I've presented a lot of bad news. Every time I give this presentation, I feel like I'm a Debbie Downer. But I promise you that there are a number of simple measures that can be taken to reduce your exposures. And Dr. Horn, who's presenting next, will talk about some of those things, some of the data that we've actually gathered to show just how effective some of those measures are. So I thank you for your attention, and I thank you for your service.